To build the management as we go through the session, but let's start by asking this same question he said. You, I think, very nicely included direct patient quotes. Sadly, this gentleman actually died at the weekend, so I think you prepared this last week. He died at the weekend. So he said, I no longer have the energy to move out of bed, which I would do before. He also told us, I want to see my family, but I don't want to see them until I'm stronger. I don't want them to see me in hospital. Okay. So, is this a common symptom? Bit louder? We did a needs assessment in Malago a few years ago, looking at patients on the medical and surgical wards, and it showed exactly the same as every other assessment of need I've seen in other parts of the world, which is the commonest symptom experienced by patients is weakness. Fatigue and weakness. It was actually of the 45% of the patients on our medical and surgical wards that had life-limiting illness, almost 90% of them had this symptom. Do we talk about it very much? Probably not, because as we'll find out, it's not an easy problem to manage. So we go to the second most common symptom, which is what? Weakness, number one. Number two symptom? Pain. Yeah, so we talk about pain a lot. And so we should. In the hospital needs assessment, around 80% had pain, but more had this symptom. So tell me, from this case, I'd like just some brainstorming. What are the causes, potential causes, of this gentleman's symptom? So I want lots of causes. We'll start from all over the room. From the back here, can you give me any cause of this symptom of lack of energy in this case? Depression, thank you very much. Anyone from this side? There's more people on that side. Ahmed? Vomiting, and why was he vomiting? We know he's got a lot of abdominal tumour mass. He's certainly liable to obstruction. I don't think he had symptoms of obstruction, but possible. What else? From the second row. Give me a cause. There's about 30 or 40, so just choose one. Either of the vomiting or of the lack of energy. We're just trying to collect all the causes. Tell me. He's not eating. Very good. Why is he not eating? Okay, so vomiting, we have so far only obstruction or tumour mass. Any other reasons for nausea and vomiting in this gentleman? Cytokines. Cytokines, very good, okay. And we'll come on and we won't ask you more about that. We'll ask Dr. Ahmed in a moment. Any other causes? Electrolyte disturbance, very possible. Actually very likely. Great. And of course there's a number of electrolytes that could be disturbed. Both his renal function. What else might I want to think about in malignancy? What other biochemical? Anemia, definitely. Not biochemical, but definitely. Calcium, I heard someone say. Very good. Keep going. Some more suggestions? His bowel, of course, could be obstructed directly by tumour, or it could be obstructed by a big liver, which certainly wasn't there on the CT scan, as Dr. Nakwagala pointed out. But you've heard of something called the squash stomach syndrome? Yeah? Where you've got early satiety, a big mass, just really not much volume. Very common if you've got extensive hepatomegaly, maybe a little less common with primary CA stomach. Any other causes? So say that a bit louder, Dr. Nakwagala. Did you hear him? PTHRP, parathyroid hormone related peptide or related hormone, related protein, sometimes people call it. That's going to result in what biochemical abnormality that we just mentioned? Hypercalcemia. Commonest cause of hypercalcemia in malignancy, and non-metastatic manifestation of malignancy, or a paraneoplastic syndrome. Endocrinologist is on the ball as ever. Anything else? Dr. Gers? Side effects of medications. What medications were mentioned that might cause problems? You're going to listen really carefully in the second case now that you know I'm going to quiz you. Okay, so the ARVs. Chemotherapy. We're not sure exactly what he had or when. Anything else? I'm glad you all didn't say oral morphine first of all, but morphine does have a place in causing nausea, particularly in the early phase of its institution. What else did I write down here? He had an episode of melena in the past. Hypotension. We've got quite a long list. Spiritual reasons for lacking energy. Are there any? Ryan mentioned depression, and there's a whole lot of psychological reasons. Tell me at least one spiritual or social factor that might contribute to lacking energy. In this case. Yes? Missing his children very much, and there's this double-edged sword, isn't there, of I'm waiting to get better, but I desperately want to see my children, but I don't want them to see me like this. That's quite a difficult place to be, isn't it? And once I get stronger, I can see them, but I'm not getting stronger, I'm getting weaker. Okay, and spiritual? Yeah? Fear of? Very possibly. On the one hand, again, saying I believe in God and I know that God's going to heal me. On the other side, he's getting weaker every day. So thank you for giving me a very fast, total, well, we talk about total pain, but the same applies to other symptoms. All of the many, and we didn't cover them all, physical causes, but also this complex psychosocial and spiritual dimension that's going on for this gentleman. I'm not going to answer any of these questions just now. We're going to go on to the second case, because we sometimes think of cachexia as unique to cancer, but of course you're very well aware that cachexia can happen in other diseases. This is a quick slide. We're going to come back to this in a moment, but just showing that the common pathway of many chronic illnesses is cachexia. We'll come back to this and look at it in more detail later. Dr. Ahmed's going to take us through some of this. But we're going to look at a second case, which is a non-cancer scenario. And again, please be listening hard for all the causes. Dr. Thomas Chigundu.